There's so much activity going on in the QA. Just a reminder, many of you have been putting questions in throughout the day, and we're doing our best to get to as many of those questions as we can with all of our presenters who are joining us right now. And this is just a reminder that the questions are to be focused on topics of their presentations and that no personal medical questions are going to be answered. It's always best to discuss those with your treating physician who has all the details of your diagnosis. Thank you also for addressing questions to a specific doctor, because that's really going to help our moderator. And now I'm happy to welcome back Brad Bryan, incoming Neuro Challenge Board Chair, to be the moderator for the Q&A. Brad?
Hello, everyone, and thanks for having me. I want to thank all the participants who have submitted their questions. And as April said, we're going to get to as many as we can, especially those that have some sort of general application. If we all right on that? We're good. Okay, sorry. Little activity here in the studio was making me think we had a problem, but we're all good. A few people, just to start out, had questions about some of the resources and the websites that have been mentioned throughout the day. I want to just remind everyone that all of those are going to be available at parkinsonsexpo.org after the fact and for up to a month after this expo, so you can find everything there that you may have missed throughout the day. Thanks again to the presenters for sticking around for the Q&A. I may direct some of these questions at specific presenters, and I may throw a lot of them out just to the field. So whoever wants to start and answer a question, please do so. And we're going to try to get to as many questions as we can. So I would just respectfully ask our presenters to answer completely but briefly, if possible. So just kicking it off with some general ones that came in through the day, and for basically anyone who'd like to answer. Can you over-exercise? With so much emphasis on exercise, is there ever too much exercise? Can it deplete your dopamine? Are there any downsides to exercise?
So I'm happy to start out by just saying, so first of all, just historically speaking, one of the things that we get a lot of questions on are things about forced exercise. And Jay Alberts, who is a good friend of mine when we were at Emory together, has a great study on this forced exercise where you do a number of RPMs, revolutions per minute when you're sitting on the bike. And we ended up with a lot of traffic into the foundation because people were trying to do too much exercise and they couldn't handle it. And so my first response is, remember, it's not a one size fits all, okay? There seems to be some benefit to forced exercise for some groups of folks who have Parkinson. And we see people that exercise and they actually need to take a little bit of extra dopamine, a half or one tablet, before they exercise. We first noticed this many years ago with our super athletes. We have PGA Tour people. We have all sorts of folks that are like out there that are really still ripping it up, that are professionals or are semi-professional athletes. But now we've begun to realize in practice that it does turn out that if you really push yourself hard, we have some folks that actually feel like it turns them on. And so when Jay Alberts put the person, one of our patients, on the back of his bike and rode across Iowa, that was helpful to her, turned her on. But not all Parkinson patients have that response, or persons with Parkinson, not patients. And so it's important to remember it's not one size fits all. And some people will need a supplement before they go. So that would be my thoughts. But others, I think.
Yeah, it's okay. I jump in there. There was a really interesting article by Pam Shaw. It's just published recently, is using a technique known as Mendelian randomization, which is a statistical method of looking for causality in associations. She published a paper on motor neuron disease, which tends to be more common, bizarrely, in British footballers, people who do a lot of exercise. And it turns out they have a larger number of individuals who have C9orf mutations. So genetic influences can be a major player to not just engage in extreme sport and extreme exercise, but also to put you at far greater risk, actually, of in this case, motor neuron disease. So just to reinforce what Mike was saying, it's one size does not fit all. We get general recommendations and they're good, but you have to be very aware of I think it is a generality. Yeah.
Great, thank you so much. I have a question for Dr. Subramanian. I have two questions for you, actually. First is, someone wrote in, what is a forest bath?
I love that. So forest bathing is this really, I think the Japanese folks had inspired it. It's, going literally into nature with the trees around you, being mindful, being present. And there's even been some research showing that trees emit chemicals that are actually really beneficial to people in general, to humans. And, nature and sort of the chemicals that are around us in the soil, in flowers, in trees have actually been shown to be beneficial for wellness in humans. So I encourage everyone to get out there. It may not be necessarily, I've seen beautiful pictures of the Kyoto kind of forests and meditation, but I think all of us can find some green space in our own neighborhoods and try to get out there and garden or just be in the forest. And I'm actually coming to you from Montana, so I'm actually taking some of this advice and using it myself with my family. So definitely encourage you guys to all do that.
That sounds nice. I had a question about, sorry, just a second. You mentioned the importance of combating isolation and loneliness, and a couple of the other presenters also touched on the difficulties the symptoms that can be brought upon by experiencing loneliness. I wonder if you could talk a little bit more about strategies for combating that, especially as Parkinson's progresses, which can make things like mobility, speech, and even motivation more difficult for individuals.
Yeah, so I think that this is hugely impactful. And I think we as the medical community have not done enough to really sort of ask about this. So I think some strategies just sort of out of the gate would be having clinicians know about this more. We're trying to educate more, having clinicians start to proactively ask, how are you doing? Are you lonely? What are your spheres of connection? And us then possibly doing referrals to maybe social work to try to connect people in this sort of social prescribing kind of concept. I think for the individual person, if it's a caregiver that's trying to motivate the patient, or the person living with Parkinson's, I think, start with small bite-sized chunks. So it might just be, getting out of your front door and waving to your neighbor across the street. It may not be, showing up to a family reunion with 50 people, for 3 days. I think, sort of starting slow, making bite-sized chunks of things that, you can try. And I think that, sometimes it's just sort of making that first step in any issue with apathy. So I think when we're trying to motivate for exercise, making a small sort of change, maybe walking 10 meters down the block and back, with diet changes. I think it's so beautiful that we've had so many amazing presenters talking about wellness, which is really something that I've been a champion for. And we've seen such a number of, people in the science community and, Laurie, Danny, Mike, all my good friends, sort of coming together here in this beautiful expo, talking about these things. And many of these things are going to require lifestyle changes. So just sort of forming bite-sized chunks that you can kind of take on a daily basis and add to, I think is really important in trying to navigate any of these things. So start with your neighbors, maybe start with the phone call to an old friend from high school, people that give you comfort, give you life. And then you can kind of expand your horizons, even, incorporating things like when you go to the grocery store, maybe a 5-minute conversation with somebody in an aisle, or when at the checkout, smiling at someone, asking them how their day is. These are small but meaningful things that can really be impactful.
Thank you for that. This question is really for anybody who wants to address it, which is a couple of people have written in echoing what was said in a couple of the presentations that motor symptoms are not necessarily the ones that are most disruptive to their life. And a couple of people mentioned specifically fatigue or muscular pain as things that they deal with. And I wonder if anybody would offer some suggestions for addressing those issues.
If I could throw in here, Brad.
Yes.
Hi. So fatigue, I think, is something that 90 to 95% of our patients experience with Parkinson's. And what we usually find is that it kind of builds up over the course of the day. And generally by the afternoon, I think most patients have a significant level of fatigue, whether or not they've been very active or not. And we've done all kinds of things to try to treat the fatigue in the afternoon by giving them afternoon caffeine. Some people have used Ritalin and other kind of upper sort of medications, bupropion or Wellbutrin. I think what it boils down to is that severe fatigue. Most people in the afternoon just have to kind of succumb to it and go ahead and take a 30 to 60-minute siesta. Whether or not you're actually asleep or not, you need to take that little time out in the afternoon just to recharge your batteries, and that usually is very helpful. Regarding the muscle aches and pains, sometimes that is associated with off periods of Parkinson's. So levodopa or any other medications that we normally use to treat Parkinson's can sometimes relieve those aches and pains. Sometimes we see that in the evening, and it presents as restless leg syndrome for some patients, where they actually feel achy and they want to wiggle their legs around. Or some people are woken up in the middle of the night with cramps in the calves, and those again can be off periods or off times. So sometimes we wind up giving extra levodopa to try to help out with that. Alternatively, people who are taking too much of these medications sometimes have this dyskinesia, or wiggling or writhing movements, and that can actually cause muscle pain too. So really, those sort of things need to be addressed directly to your doctor so that they can determine which one of those sort of conditions might be affecting you.
Excellent. I have a question for Dr. Bega, which is, do you have specific thoughts about exercises like swimming, golf, other kind of pastime-oriented exercises that that people might be enjoying? Are those also beneficial?
Great. Yeah, those are great questions. First of all, swimming is one that a lot of people like who particularly have joint problems, because you're not putting a lot of pressure on your joints. And so a lot of people with arthritis will like to use swimming. And I think someone asked about whether there's any evidence for benefit in Parkinson's specifically with swimming, because I didn't mention it in my talk. And there is actually, there's a study that kind of combined evidence from a bunch of different studies looking at swimming versus what they call land-based exercise. And people who have like fear of falling or balance problems particularly seem to benefit more from water exercise compared to land-based exercise. So there's that benefit, there's the joint benefit, and then also it's a good range of motion and an aerobic exercise. So lots of benefits there for swimming. Not particularly good for people with deep brain stimulation, we find out. But other than that, it's a good form of exercise for a lot of people who have access. And then hobby-based exercises, I'm a big fan of, because if it's a hobby, you're enjoying it, you're going to participate in it, you'll do it. Now, being aware that that may not be a good source of all of your exercise. So for instance, golf, probably not going to replace all of your forms of exercise in terms of getting your heart rate up, which we know is important with aerobic workouts, strength building. But still, I find that being active is more important than being sedentary. There's advantages to really any activity in that regard. So I encourage people to do it, but it may be in addition to some of the more typical exercises that get your heart rate up. Pickleball is another one that a lot of my patients seem to love. I actually learned about that from my patients. I think that's another way to do an aerobic workout that people seem to enjoy as a hobby-based activity. And it's social as well.
Great. And a quick follow-up question for you too. You mentioned the importance of high intensity in your exercises. Do you know why that's important, and how much do people need to really focus on achieving that high intensity workout?
Right. So there's actually ongoing research to figure out if higher intensity is in fact more important than moderate intensity. So we don't know for sure that that's the case. We have some evidence from some studies that at least moderate intensity exercise is potentially more beneficial than low intensity, like taking a stroll around the block. Why that would be, potentially just kind of working the muscles out more, maybe greater release of endorphins and dopamine, and general cardiovascular health, kind of kicking up the level of exercise to a higher level, we know from a cardiovascular standpoint is beneficial. So those are probably reasons, but we're still actually investigating sort of a recipe for what is the right kind of exercise. And then again, it has to be individualized. There are some people who are just not going to be able to achieve what we would consider high intensity exercise, and that shouldn't discourage them from still participating in exercise. And I even mentioned, even for my patients who are wheelchair bound, still really encourage them to exercise. They may not be able to get to the same level of intensity as some of the younger, very active patients, but there's still a lot of benefit for all the various motor and non-motor aspects that we talked about to doing that, those chair-based exercises. And so it really should be tailored to the individual abilities.
Thank you very much. I have a question for Dr. Mischley. We had lots of individual questions coming in about specific food items, and some which may or may not be implicated in promoting dopamine in the brain. A couple people mentioned things like velvet beans, fava beans, avocado oil, MCT oil, which I'm not personally even familiar with what that is. But should people be thinking about specific foods in that way? Is it more important for them to focus on, the evidence of a healthy diet? What are your thoughts about that?
So there are a couple naturally occurring sources of dopamine in the diet. Fava beans and mucuna are two of the most common, and fava beans actually also contain carbidopa. To get the maximum amount, you would need to juice the 6 to 7 day old sprouts, and what you would essentially be doing is getting like an herbal cinnamon. It's a lot of work for not very much payoff. It definitely contributes a little dopamine, but enough to be confusing sometimes and change the pharmacokinetics. Some people can use a little levodopa mucuna to bridge gaps between meds. Head-to-head studies, it works a lot like a pill if you take doses of mucuna, but you can't eat enough fava beans to get your morning needs met. It's just not going to happen. But you can supplement a little, but most people don't find it terribly useful, especially long term. No.
Okay. I have a couple of other sort of specific questions, if I could, for you. You mentioned avoiding canned food, but that was new for me and kind of alarming, honestly. What about frozen vegetables? Someone asked, are they as good as fresh vegetables?
Frozen are actually on the faster progressing list, not so severe, but actually the more frozen vegetables a person ate, the more severe symptoms they had over time. Frozen fruit was a little bit to the positive, not very notably, but definitely on the positive protective side. So it must not be the freezing. It's something, I don't know what that is. I thought it was income. Maybe we do adjust for income. People who live in food deserts, financial scarcity are more likely to do frozen over fresh. There are a lot of, but even after adjusting for income, that's there. So there is a new, I put a couple months ago on my Facebook page, a news, East Coast news group did an expose on the backstory of where frozen vegetables come from. And, there are definitely some sprays and preservatives and processing that happens behind the scenes that I wasn't aware of. So it could be that there is a treatment happening to the peas and beans behind the scenes that we don't see. I think, there's a lot that needs to be explored. So, but very consistently for the last 6 years, the more frozen vegetables a person eats, the faster the disease progresses, although not very significantly.
Okay.
Can I just add just a quick point to that?
Yes, please.
I think these studies are absolutely critical that they're done. At the moment, we need more participants. So I know Laurie's trying to get more people into her studies, and she tweeted something out for you. And we need other groups around the world to replicate these and to make sure we understand, like what they mean. So Laurie's like a pioneer. So this is like first cut data that's coming out, but we're Parkinson is, it's such a complex syndrome, and if you have one form of Parkinson, Foss Bloom said recently when we wrote in the Lancet, he said we should title that article Parkinson's Diseases, and so how it affects everyone, and so it's just, it's like if you were reading the Bible, we're in the first couple paragraphs of Genesis, and Laurie's trying to figure this out, and so she needs more data, and more groups are going to bring more data. The disappointing thing for me, Laurie, is that everything you say would turn over my whole dietary strategy for myself, which is basically I like to eat everything I want because whenever I want. So
don't we all?
But that'll have to change, right, at some point. But at any rate, it's a great conversation.
Thank you for that. Dr. Sutherland, I have a question for you about Kinmobi. Well, it's related to Kimobi, which is, are on and off periods only associated with levodopa, or do other Parkinson's medications also have a relationship with on and off periods?
Okay, so I'm going to answer these questions not as being a Kimobi representative. So just as in my
Great.
So on and off periods can be associated with any Parkinson's medication, frankly. It depends on the half-life, which is how long the medication stays in your body, how quickly it gets out of your body, gets chewed up by your liver or detoxified by the liver. So a lot of issues in there. The dopamine agonists, which are ropinirole, rotigotine, and pramipexole, those also can cause on and off periods, although they're not quite as famous for causing them as levodopa is. Levodopa, I think, is the one that we all feel is probably the biggest biggest causer of on and off dyskinesia, things like that. Sorry, we have a plane going on overhead. And then the second part of your question was what?
That you answered it. I do have a follow-up question though, which is a couple people wrote in about different formulations of quote unquote rescue, levodopa, Kimobi, inhaled versions, injected versions. And is that something they need to just speak to their doctor about? How do you manage which one is right for you?
Well, of course, you need to talk to your doctor about it. And a good way to do that is you can go on different websites, Michael J. Fox Foundation. You can go on Parkinsons.org. You can go on different places and look for, they have symptom checklists, and you can go download some of those symptom checklists, or you can find them in books and things, and fill those things out. And part of those usually will be about your off periods and how you're feeling. And if it really looks like that's a significant issue for you, or if you're noticing even after coming to these talks, then you should talk to your doctor about it, because there are different patients have different needs. I always say if you have 100 different Parkinson's patients in a room, you're going to have 100 different combinations of symptoms and medications, and everybody's very different. They call this a boutique disease for that reason, because everybody's different with it. But usually there's some way we can at least try to either tweak your medications or add on another medication to help with the sort of on and off fluctuations and wearing off.
Excellent. Dr. Subramanian, are you still with us?
Yeah.
I had a question about how does mental health care fit into the wellness approach, and thinking about apathy and purpose of life and those sorts of things? Is mental health care something people should be seeking out?
Yeah, I mean, I think they marry very beautifully together. And I think that, so much of, I think the pandemic has emphasized how important mental health is to all of us. I think many of us, I know I've had multiple conversations with Laurie and Mike, different times, just sort of trying to reset, what is happening in the world, and trying to, reframe a lot of, what our sort of focus needs to be moving forward as Parkinson's, people who care about Parkinson's patients. And I really think mental health is absolutely the focus that needs to be brought into the conversation. I think wellness is sort of almost an antidote to some of the mental health issues that are happening, is kind of an exciting, I think, sort of paradigm. And so I think that, a lot of us in our own lives have been isolated, suffering, feeling moral distress, sort of feeling fatigue around just, this long pandemic. And I think as we're seeing our patients reemerge, many of our patients have lost a year and a half of, interactions with people that they love, or lost loved ones through COVID or other sorts of things. And I think we have to recognize that mental health is part of holistic health, and it's actually foundational for a lot of what we are treating in Parkinson's disease. I think we've really spent a lot of time talking about motor issues with tremor and gait, but I think if you're not feeling well from a mental health perspective, it's really going to be hard for you to feel good about your non-motor symptoms, to feel then good about your physical symptoms. And I think this is sort of then sort of a vicious cycle that can really lead to our patients not doing well from many perspectives. So absolutely, mental health is part of health, holistic health. And if you're suffering in these arenas, you need to be telling all of your providers, your primary care doctors, anyone you meet, your physical therapists, if you're seeing Parkinson's physicians, absolutely tell them this is absolutely part of the disease and is a cornerstone, I think, of succeeding as we come out of this pandemic. So please do identify these issues. There are treatments. A lot of the wellness strategies that we talked about today, in this amazing panel that we've brought together. And I, again, applaud the Parkinson's Expo people for putting this panel together. I think we have to really look into how all of this interplays, and you need to seek actively treatment and help if you're having these issues. So please do do that with the people that you have in your space. And if you have these issues, tell the people even in your world, you know, in your own communities about these things. Try to come up with strategies that are culturally sensitive. I know some of my patients that are Latinx, you know, maybe getting together and dancing, you know, to find salsa music could help with some of these strategies. So I think, again, we have to be thinking a little bit more holistically, a little bit more open-minded to all the communities that we're not serving right now. And mental health is absolutely an important focus. So thank you for that question, actually.
Thank you. Dr. Mischley, this one was directed at you, but I'd also like to just throw it out to anybody who would like to answer, which is, are there general guidelines that you give your patients with regard to coffee and alcohol consumption?
Yeah, so coffee has historically in epidemiologic research been the more coffee you drink, the less likely you are to get Parkinson's disease. However, most people once diagnosed with Parkinson's tend to find it makes them jittery, makes their tremor worse. People don't actually like drinking 3 and 4 shots of espresso per day. It's even if it
Some of us do.
Even if it offers some protection, most people don't find it's very helpful symptomatically. So coffee is great, just don't add a bunch of milk and sugar. Some people think it helps with the morning bowel movement, especially if it's on the bitter end of things. And then in terms of alcohol, wine is actually on the list of foods that was on the protective list. So liquor was neutral, beer was neutral. And I'll just say in clinic, people with Parkinson's, whether it's glutathione insufficiency, whatever it is, don't feel well after more than a couple drinks. I mean, it's very easy for even 1 drink, 2 drinks to really mess with people's sleep. So again, even with wine on the protective list, most people, it tends to be self-limiting. People don't feel good after 2 glasses of wine. So
Getting a caffeine
go ahead,
issue.
Dean. Yeah, go ahead, Dean. I'll add to you.
Hey, let's hear from Dr. Sutherland first. Sorry.
Yeah, so getting back to the caffeine issue, there was a couple of studies that were done with looking at higher dose caffeine with Parkinson's patients to try to relieve their fatigue. And the upshot was that it does help relieve fatigue up and even some motor symptoms up to probably 3 or 4 cups a day. But around that level, people also started to experience headaches and nausea. And so really there's a limit there. But for some people, it is beneficial.
Thank you. And Dr. Okun.
Yeah, just to add to both of what's been said already, just remember a lot of folks misrepresent some of the studies, even the media misrepresents it. Remember, I think Laurie said this before, there's a difference between risk of getting Parkinson and then once you get Parkinson. And so what she's talking about is there's a very slight, we do these things like Las Vegas betting, and there's a very slight, what's called odds ratio that's protective for caffeine before in order to get it. Once you've got Parkinson, cat's out of the bag. To add on to what Dr. Sutherland said, people need to understand there are different types of tremor. And so the general sense of folks in our practice is, you know, caffeine makes tremor worse, but that's not, like Dean said, necessarily true in Parkinson. But once you get to a certain level, it can make it worse or not any better. And so there might be some symptomatic benefits. There's been some conflicting studies around Postuma, even within some of his own studies, as he's followed it up. And so it can be, you know, like something you need to be careful. And then the last point is just be kind to folks with Parkinson's. So everybody listening, we all need to be kind and realize you need to have dozens of studies and Dr. Tanzi said this in our discussion, when you get an association, associations are not causative. We need dozens of studies lining up all this data to say, we're absolutely sure about can this or that and everything. We're not quite there. So please, you have a degenerative disease, enjoy your lives. And so make sure, obviously, you're not going to choke, you know, on certain types of food, but if you like to eat certain foods, you know, it's my solemn opinion after doing this for many years, we should let people enjoy their lives some. Now, you want wellness and you want to have good health and you want to definitely be careful with your nutrition. But if there are certain flavors, certain things you enjoy, definitely have it. Watch out for wine. Too much wine, you know, can make you feel bad, or alcohol can also throw off your walking. But if you love the taste of it, you know, gosh, you know, even if it's a little dangerous, put a little in the bottom of the cup so it doesn't affect your thinking or your walking, just so you can get that taste of it. that's okay. So just, I would say the longer I do this job, the more I'm trying to be kind to people so they can enjoy their lives, and I don't turn into their, you know, their fathers or their mothers pointing the finger and saying what you can and can't do. So, yeah.
Well, thank you for that. Quality of life is so important, and I think that's a great reminder for all of us. And everyone, that is the end of our question and answer. It flew by. I want to thank you all for taking the time to stick around with us and to answer all these questions. We had so many great questions come in. I'm sorry to all those of you that sent in a question that we did not get to, but I'm really glad that we were able to offer this. And once again, thanks to our presenters.
Thank you, Brad.
Thanks, everybody.
Thank you.
Thank you.